Hi everyone, welcome back to another video. Now I'm going to continue with the series where I explain different muscle groups and how they work, like anatomically, physiology, and then how you can train these muscles with body weight exercises. So with no weights or without going to the gym or using machines and all that stuff. So today I'm going to talk about the rotator cuff muscles. So these muscles are very, very important because they're going to help to stabilize the glenohumeral joint. And so as you move the shoulder in different directions, and if these muscles are well trained, they're going to keep the humerus in the correct position so that you don't have any problems like impingements, like going over, making some muscles do overwork, and so at the end of the day you may have tears or stuff like that. Now there are 4 muscles that are going to make the rotator cuff. Now the rotator cuff is called like that because these 4 muscles are going to surround the head of the humerus, and they're going to help, as I said, stabilize the joint. So these muscles are with the capsula are going to surround and rotate around the head, and they're going to keep it fixed as you move it. There are 4 muscles, as I said, that are going to make the rotator cuff: the subscapularis, the supra and infraspinatus, and the teres minor. Now today I'm going to especially talk about the external rotators. So the 2 of these 4 muscles are going to participate in external rotation of the shoulder, and I'm going to just explain to you briefly why it's so important to train these muscles more than often and really training them a lot. Now here I have a towel that I'm going to place in this position because this is very similar to the shape of a scapula. Of course it's not exactly the same, but it's similar. And now the scapula is a bone in the back, and I've already shown it to you. You can find it here in the lateral part. So this, for example, this part is the scapula, this part of the bone is the scapula, then here you can find the spine of the scapula, and so on. So it's this bone that has a triangular shape like this. So if you look at this one as the right scapula, you have the medial border of the scapula, the inferior angle, then you have the lateral border, the superior angle, then here you have the spine of the scapula, and then here at the top of the spine there is the acromion, all right, that is this thing right here that you can find in the side. And here the acromion is gonna have a joint with the clavicle, so the acromion clavicular joint, so the AC joint up here, and then yeah, so those are the main parts of the scapula. Now that it's important because these 4 muscles, so the 4 rotator cuff muscles, are gonna all originate from the scapula, and they're gonna all attach to the humerus. So I'm gonna just go in order. So the first muscle that we find is a muscle that actually is on the other side of the scapula. So imagine the side of the scapula that is the closest to the rib cage, all right? So the ventral side of the scapula, that is the portion from which is going to originate the subscapularis muscle. So it's going to originate from here, pretty much. It's going to run towards the humerus, imagine like this, all right? And it's going to attach to the internal side of the humerus, right? So to the minor tuberculus of the humerus. And now because of this muscle, it's gonna have these, the fibers are gonna run in this direction. This muscle, when the fibers contract, right, this muscle is gonna make the humerus internally rotate. So these fibers are gonna internally rotate the humerus. So that's the subscapularis. Then if we go again to the normal side of the scapula where we have the spine, we have a muscle that's going to originate from the upper part of the spine, so from a fossa that is on the upper part of the spine, that is called supraspinatus. And now this muscle is going to run pretty much laterally, then it's going to rotate, it's going to go under, so the tendon of this muscle is going to just pass beneath the AC joint, so beneath it, and then it's going to attach to the lateral to the great tuberculous of the humerus, so to the external part of the humerus, so pretty much like here. And so when this muscle contracts, it's gonna help abduction, so it's gonna help to abduct the arm. So abduction is the movement in which in this case the humerus is being brought away from the midline. So this is abduction. Now this muscle is gonna only work in the first 10 to 15 degrees of abduction. Then it's mainly the deltoid that is gonna perform the abduction. But this muscle is quite important because it's a stabilizing muscle. So when you're hanging, so for example, when you're just walking like this, all right? So you see that the gravity, because of the weight of your arm, the gravity is like pulling your arm away from the glenohumeral joint, right? So it's bringing the humerus down. Now this muscle is going to help the head of the humerus not to fall too down. So it's going to keep it close to the glabella, right? So that's pretty much the two functions of this muscle. So it's a co-aider on the abduction in the first degrees, and then it's going to just help the deltoid, you know, in performing the abduction. So it's mainly the deltoid is going to do it, but the supraspinatus is going to be a little active. And then especially in holding the head of the humerus when gravity is pulling it down, right? So keeping it close. Then here from the spine, if you go beneath the spine, then you can find another fossa, and from here the infraspinatus muscle is going to originate, and this muscle is going to just go laterally, all right, and it's going to just run like this, and it's going to attach again to the lateral, to the great tuberculous of the humerus, so laterally. Now when this muscle contracts, you can already see that it's going to bring the humerus laterally, so it's going to externally rotate the humerus. It's going to do something like this or this. This is just better to visualize it. So this is external rotation, this is internal rotation. So subscapularis, infraspinatus. And also the teres minor, that is a muscle that's going to originate from the lateral border of the scapula, is going to just be just beneath the infraspinatus, so it's going to just do the same, like the fibers are pretty much doing the same movement, and it's going to attach to the great tuberculous of the humerus. So yet again, the teres minor is another externally rotator of the humerus. And that's it. So those are the four muscles. That's the anatomy, when they originate, where they attach. And now why these four muscles are so important. As I said before, they're gonna stabilize the glenohumeral joint, the head of the humerus, and especially when you have these muscles well trained, especially the two external rotators, so the infraspinatus and the teres minor, these muscles are gonna like create room inside the glenohumeral joint, so that there is more room. So that, for example, when you do flexion, or when you do abduction to full, like that you're rotating completely the humerus, if you have more room here, the humerus can rotate more, right? Instead, if you have less room, the humerus is gonna like touch the bones from the scapula, and it's gonna be fixed, and it may cause pain, it may cause an impingement, it may just be uncomfortable, like performing the full flexion or the full abduction, right? And that's pretty much why these muscles are important. Now, the externally rotator muscles in particular are also important for a postural reason, because of the fact that there are a lot of big muscles that are gonna internally rotate the shoulder. For example, pec major, latissimus dorsi, anterior deltoid, and pec minor. You know, all these muscles are gonna just, you know, internally rotate the humerus and mainly just bring the head, the scapula towards the front, so like this, right? These big muscles are gonna all internally rotate the shoulder, as I said. So they're gonna do this kind of movement. So instead, if you look at the external rotation, the only externally rotator muscles are the two of the rotator cuff, so infraspinatus, teres minor, and then the posterior deltoid, and that's it. So these three muscles, if you just exclude the posterior deltoid, because it's just you know, it's just an aid, so it's not going to really perform just, you know, external rotation. It's just two muscles, very, very small, against like three big muscles like pec major, deltoid, and anterior deltoid and latissimus dorsi, that instead are gonna internally rotate. So there is a big imbalance between these two sides, and that's why people, when you overlook training these external rotator muscles, are gonna have their shoulders like this. So have you seen like bodybuilders or like power lifters, if they don't train enough their postural muscles, they're gonna have their shoulders like this, and they may even have, you know, the head falling down like this. So you see these big guys with these big pecs, these big muscles, having the shoulders like this, right, and like this. So this is the posture that they have, and that's of course a problem, because if you have the scapula and the humerus internally rotated like this always, so like a fixed position, when you try to do every movement, you're already placing yourself in a high risk of injury, because like when the humerus is anteriorly rotated, you can't really like complete the movement, because there is a mechanical problem, so the humerus just can't rotate. So you need to externally rotate it to be able to actually perform the full range of motion. And also because of the fact that no one really wants to have this posture like this. You want to have a healthier posture, so with the chest up, with the shoulders back, down, and you know, not looking like a gorilla, so not having your hands in front of you, but having your hands to your side. And that's why it's important training, especially the external rotators, so the infraspinatus and the teres minor. So now that being said, I'm going to show you some exercises that you can do with both elastic band, or if you don't have, it can be a weight. So a weight, or it can be like water. So whatever you can find at home, it can be used to train these muscles, because again, I repeat, these muscles are small. They have a very important role in stabilizing the shoulder joint, but they're not big. So you can't really go with heavy on these muscles. You need to go very slow, very light, elastic bands, doing, you know, the good movement, not trying to compensate or to use, you know, the other big muscles. You need to do just a slow movement, you know, control, feeling the good contraction. And in that way you can train specifically these muscles because they're small. So in my case, with the elastic band, it's just the best option in my opinion. So when you're trying to train external rotation with the elastic band, you must place yourself in a position where you're gonna have the elastic band pulling you against external rotation. In this case, you can train external rotation from your side. So for example, like this. So you tie the elastic band somewhere, like to your side, and then you place your other hand on top of your arm, and you really try to keep the head of the elbow close to your body. You don't wanna, when you do this movement, you don't wanna lift your elbow and use your other muscles. You just wanna rotate the humerus head, right? So in this case, imagine I have the elastic band here tied in my left side, and all I'm doing is this, all right? So imagine here, I'm doing the movement. So the more you go into external rotation, the more the elastic band is gonna tight. It's gonna become tight, so it's gonna pull yourself more. So you need to control the contraction, the concentric part, and then eccentrically you need to control also the other side. So you do the two types of contraction at once. So tick, and then you control, then again, and then you control, again, and you control, and you do to both sides. 12 to 15 reps. Or also there is another way you can do this in the horizontal plane. In this case, you're in front of the elastic band. You're gonna tie it again, probably a little higher this time. So imagine it is tied like up here, and then just keeping your arm like this. So 90 degrees here, 90 degrees with the elbow. You just wanna move the humerus. So the wrist is fixed, the elbow is fixed, the shoulder is fixed. It's just the humerus that is rotating laterally. Right? So it's just it. And sometimes it can be helpful if you bring, like, if you leave your elbow So if with your wrist, you go a little past your elbow. So for example, if you look at the side from here, so if you do this, so if you can go with the wrist a little higher than the elbow, that's even better because you're achieving more degrees of external rotation. But without, of course, without moving the shoulder too much, so having the shoulder fixed. So in this case, you have the elastic band in front of you, like this. So you have the elastic band pulling you, like this. So you stabilize, and then you do this movement. So one side, then you change side to the other one. Again, 12 to 15 reps, and should be done. So these two main exercises are just the best, in my opinion, to train external rotation. As I said, these muscles are small, so go slow, you know, feel really the contraction. It's very, very deep. You're gonna feel a burning in the, like in this side, so deep beneath, like in this side, right here. And boom, and you do like 2-3 sets. You can do this exercise all day if you want to. Personally, I do them like all the time. I do pull-ups or push-ups. I do this exercise before, like as a warm-up. So I do like 2 or 3 cycles of this kind of exercises, changing sides, and boom, that's it. Now, if you don't have an elastic band, you can use, as I said, a weight. So it can be a weight, a bottle of water, whatever. And you know, in this case, you must have like something to lie upon. So it can be a bed. In this case, you just leave your arm straight, like this, for example. In this case, all right. So just leave the elbow out, and you grab your weight, and then from here you just want to externally rotate. So again, trying to not move the shoulder, not move like not compensating but rotating, or you know, lifting the shoulder, stuff like that. You just want to externally rotate. So from here to whatever you can, and then down. Here, up, down. Here, up, down. You can hold as well like 1 second in the top contraction, so you feel more like the muscles working, and then you go down. So up, again, and down, and so on. So in that way, you can train with a weight, a bottle of water, whatever. You can train external rotations if you don't have any elastic band. Yeah, that's pretty much it. So remember, guys, it's important to train these muscles, especially, as I said, the external rotators. The subscapularis is going to internally rotate, and as I said before, there are other big muscles that are going to also internally rotate the shoulder. So most of the times you don't need to train the subscapularis. Maybe you need to stretch it, but train it normally you don't need to, because as you are doing internal rotations with the other big muscles, you're also doing it with the subscapularis, so there's no need. And the supraspinatus, as I said, is gonna just be more a static muscle. So as you are actually contracting and abducting the arm, is more the deltoid that is working, not really the supraspinatus. But again, normally the problem with the supraspinatus is that you have the other muscles not trained enough, and so you have less room in the glenohumeral joint, and so every time you're doing a shoulder flexion, you are impinging the tendon of the supraspinatus against the AC joint, and it becomes inflamed, it can tear, and that's the problem. Like 75% of the problem of the shoulder is the supraspinatus tendon being teared by the head of the humerus. So again, that's why it's important to train the other muscles to create room so that you can move the head of the humerus without hurting your supraspinatus. And yeah, I hope you guys enjoyed, and see ya. Bye bye.